Physician burnout is a serious problem in America and most of the developed world. Over half of American physicians are burned out, 54%. Burnout is a syndrome that includes emotional exhaustion, social isolation, cynicism, ineffectiveness. So a physician who's burned out is impaired. There are serious issues for patients. Patients have a poor experience. They have a measurably poor outcome for their conditions. There are safety issues for patients. There are more serious medical errors among burned out clinicians. They're less productive. They're more likely to leave the workforce. They're more likely to think about committing suicide. So it's a serious issue that's systemic in this country, and it's a patient safety, experience, and outcome issue that we need to address. Our teams at Mayo Clinic have worked for years to lower physician, nurse, social worker, staff burnout, because we know it'll make for a better patient experience and better patient outcomes. Our numbers are going down at about the same rate that the national numbers are going up. So we're substantially lower rates. We know that it's possible to reduce burnout, and mainly it takes time and attention. It doesn't take a big capital budget. We need to start at all organizations in our country by measuring burnout, and that should be part of an annual survey at least, so the leadership of the organization knows where the largest opportunities for improvement are. If we know it's a serious issue for patients, we should be measuring it and then dealing with it. So the first thing is measure staff burnout, staff engagement, staff satisfaction, staff joy in work. We also need to measure the effectiveness of frontline leaders. One of the most important determinants of burnout and engagement is the frontline nurse manager, physician leader, social worker leader for all these areas. And good leadership at the front line makes a difference for engagement and burnout. This can be performed at any organization in the world. It takes time and attention. It doesn't take a capital budget. The most important thing is there are two basic things. The first is for the frontline leader to have 5 behaviors in his or her interaction with the staff. It's not rocket science. The 5 behaviors are basically, I take an interest in your ideas. I'm interested in your career. I communicate transparently with you. I'm inclusive. Everyone feels like they belong. And so you have all the information that I have. I want to hear your ideas, and then it's a participated management with collaborative action planning to look at the best opportunities to improve care for patients and and remove the ineffective and frustrating processes that sap your joy. So you have to measure joy. You have to make sure leaders are equipped to engage their frontline staff. We can do that any place. Clearly, frontline leaders are important. The other behavior and activity for frontline work groups, which is where the major origins of burnout occur, are to look for the pebbles in your shoes. So that it's an open conversation where frontline leaders listen. They ask their staff, what brings you joy in work? What saps that joy? What are the pebbles in your shoes? And then through quality improvement, process improvement, changing policies, improving communication, the leader works with the nurses and physicians and other clinicians to take those pebbles out of their shoes, those irritants, the inefficiencies. And then just the act of working together as a team is therapeutic. And then the result of having a more efficient, less defective process or communicating care team will clearly help in the burnout efforts.